Many women suffer with chronic pain and inflammation, with conditions such as arthritis and osteoarthritis being amongst the top complaints. So in studio, I'm joined by Dr. Mark Opperman to chat to us more about the role of hormones when it comes to pain and inflammation. Mark, welcome back. Good to have you here.
Thank you, Michael. It's always good to be here.
So let's start. Pain and inflammation. Why is there a link between this and hormones? Where do we fit this into the puzzle?
So I think we need to step back and make it clear that pain equals inflammation.
Right.
So when we look at, for instance, menopause, we see that menopausal women have a higher inflammatory response and higher levels of inflammatory markers.
Okay.
And the moment that we put them on hormone replacement therapy, these markers decrease, so the inflammation decreases.
Right.
In chronic pain conditions or chronic inflammatory conditions, it's clear that these symptoms of pain get or increase during lower levels of estrogen. And we see that with menstruation, during pregnancy, post-pregnancy, and menopause. And the moment that we go into menopausal women, a very interesting fact is that they have a higher inflammatory response to infection than premenopausal women. And they have a far higher incidence and risk of developing things like autoimmune diseases, especially rheumatoid arthritis.
So Mark, you mentioned rheumatoid arthritis and osteoarthritis. These are generally known as inflammatory diseases. Let's talk about the pain associated with that or with these conditions.
Okay, so Michael, firstly we need to understand that as we slow down the production of our ovarian steroid hormones, now these include testosterone and estrogen, we see an increase in inflammatory conditions, overall inflammatory conditions. And this predisposes us to immune disorders, especially rheumatoid arthritis.
Okay.
Now, one of the conditions that is known to increase in severity during menopause is multiple sclerosis. So it's very clear that estrogen has a downregulation on inflammation. One of the more severe diseases that's associated with inflammation, for instance, is Alzheimer's disease, where our insulin, one of the other hormones that is called the stress hormone, increases the deposit of amyloid in the brain. And this is what causes Alzheimer's disease.
Okay.
When we look at osteoarthritis, on the other hand, there's a big difference between the two. Rheumatoid arthritis is an absolute autoimmune disease. Osteoarthritis sometimes happens because of overuse of joints or damage in joints.
Okay, like wear and tear, effectively.
Wear and tear, basically. We've spoken about the Women's Health Initiative study. It was the biggest study that was ever conducted on women's health conditions. And 77% of women in this study reported some form of joint pain.
Okay.
And when they started on hormone replacement therapy, the condition improved dramatically.
Okay.
The Koreans, during their part of the study, went further, and they actually went and they looked at x-rays of these patients and saw that when they started the estrogen therapy, the joints started looking healthier and better.
Fascinating.
What's important to note is that when we start hormone replacement therapy in these patients, the disease process slows down in both osteoarthritis as well as in rheumatoid arthritis. And we are now getting to the point where treating these autoimmune conditions, it's becoming standard practice to start these patients on hormone replacement therapy.
So it's not necessarily a cure, but certainly, as you say, it slows down the disease process.
It's an
so it's
add-on,
not
basically.
going to get worse.
Yeah,
or,
it
or
slows
much.
down that
Yeah.
process.
Okay.
We spoke about the steroid hormones that's produced by the ovaries. So the steroid hormones will include testosterone and estrogen. Now, we've spoken about testosterone and pain in previous episodes, where we know that downregulation, decrease in testosterone levels, decreases the effectivity of opioid pain medication.
Yes.
So optimizing these hormones allows us to optimize our pain management and decrease the amount, especially of opioid medication. And when we optimize estrogen levels, we decrease the need for anti-inflammatories because estrogen in itself is an anti-inflammatory.
It's amazing.
So decreasing medication use, saving things like our kidneys,
Yes.
which is one of the most debilitating forms of disease. It's the symphony of hormones that affect one another. Stress affects our gut affects our brain affects our hormones, and that affects how the gut reacts to the specific hormones. So, it's our modern lifestyle is not conducive to a healthy life.
So let's go to that for a moment, and we don't have too much time left, but just as a recap in terms of things that we can do from a lifestyle perspective to reduce the inflammation that exists in our body as a general underlying condition, and thus potentially reducing pain associated.
So one of the things that on this channel or on this program is discussed at length is healthy diet.
Yes.
Healthy diet means get rid of all the excess sugar and refined sugars, the artificial stuff. So that's number one. Alcohol consumption is not great for us.
Yes.
If you ask me to stop drinking gin, I'm going to tell you to go away. So, but
Moderation.
moderation
Yeah.
of that. And physical activity.
Right.
That is probably one of the most important things that we can do. We live in such a stressful environment. De-stressing, getting out in nature, listening to music, sitting, immersion in water, get into the pool, something like that.
Yeah.
That decreases stress. Stress leads to inflammation. Inflammation leads to deregulation in all the hormone systems, leading to chronic conditions, especially autoimmune conditions.